Welcome to our poster presentation. We're going to present this poster titled Model of Thrombogenesis Dynamics in Patients with Atrial Fibrillation. My name is Rebeca Pacheco López. I'm a master's student in molecular biomedicine of the Instituto Politécnico Nacional, Mexico.
My name is Raquel Pacheco, and I am a doctor, and I am the one who provides the biological data.
I'm Elisa Domínguez. I'm a systems biologist working at UNAM.
Okay, this mathematical model tries to represent the biological behavior of the process of thrombogenesis in the patients with atrial fibrillation. Atrial fibrillation is a tachyarrhythmia that means that the heart beats at very high frequency, bringing with it various consequences. One of them is that by beating so fast, the heart doesn't contract correctly, which generates a blood stasis that and also causes the blood flow to be turbulent, which cause damage to the endothelium of the heart and activate platelets. All of these are the main mechanisms of the formation of clots or thrombus, which can be formed in the left atrium and can be traveled to the any time towards to the substance circulation and can cause the most fearsome complication and a stroke. We are facing a vicious circle of atrial fibrillation where atrial fibrillation produces more atrial fibrillation through a remodeling of the cardiac tissue, and over time, AF is capable of increasing the left atrial size, which favors blood stasis, and this is reflected with less blood coming out with each heartbeat. This is what we call ejection fraction. Therefore, our objective was to represent and analyze within the framework of systems biology the dynamic process of the thrombogenesis, which can be capable to provide information of thrombotic risk.
To achieve this objective, we first choose the clinical variables to construct the model in base of the statistic analysis. Then, we constructed the interaction network and formulate the ordinary differential equation using the action mass law. As you can see in the model, we have four variables: auricular fibrillation, left atrial volume, ejection fraction, and thrombus. We represent the vicious model between atrial fibrillation and left atrial volume in equations 1 and 3. The decreases effect of left atrial volume on ejection fraction in equation 4, and the promotion and inhibition of the thrombus in equation 2. Once we have the equations, we proceed to analyze the parameters local and global sensitivity. For the local sensitivity, we variate one parameter at a time, letting the rest fixed. While in the global sensitivity analysis, we variate all the parameters at the same time. As a result, we found that the parameters related to the left atrial volume and ejection fraction were the most sensible. To further analyze our data, we made a principal component analysis where we found a cluster corresponding to patients with atrial fibrillation that had had a stroke. Also, we searched for the principal contribuent of the new dimension variables, showing that ejection fraction was the major contributor, especially in the dimension 2. Finally, we reconstruct the subductemporal trajectory of our data. It's worth mentioning that this algorithm is most used in single-cell data analysis, so its use with clinical variables is innovative. With this, we use cross-sectional data to obtain an accommodation that simulates the time series data and can get closer to the reality. Here, we observe the pseudotemporal trajectory of ejection fraction, where it decreases as the disease evolves, reproducing the biological phenomena. In conclusions, we can say that the left atrial volume and ejection fraction are important to represent the thrombogenesis dynamic in patients with atrial fibrillation. However, there are needed more analysis, like the parameter optimization, to validate our model. We thank to the Hospital General Miguel Silva to facilitate the data and to the first woman in Bioinformatics and Data Science LA Congress. We invite you to see the poster in the Congress Twitter where you can send us your questions.